Hi, my name is Ivonne Martinez, and today I will be showing you how to do an indwelling urinary catheter for a female. Okay? All right. So first things first, I'm going to go ahead and get my EHR, get my patient's information, and check my healthcare provider's orders. Okay, so right here I have my patient, Anna Pawlowski. Allergies is penicillin. She reacts to them with hives. Date of birth is 5/5/1997, and my order is to place a Foley catheter for urinary retention, and we're going to go ahead and do that today. Okay, so this is my patient over here. This is my setup. All right. So we're going to go ahead and, hi, my name is Ivonne. I'll be your student nurse today. Hand hygiene as I'm walking in. May I please have your name and date of birth? Okay. Anna Pawlowski. Birth is May 5th, 1957. Okay, Anna. Anna, and I see that you do have a wristband right here. It says an allergy. What kind of allergy do you have? Penicillin? Okay, perfect. And what is your reaction? Hives? Okay, great. Make sure, yep, it is noted that you do have a reaction to penicillin. Perfect. And Anna, today what we'll be doing is we'll be doing an indwelling catheter. Do you know what that is? Okay, you do. Okay. Well, and you said you've had it before? Okay. Did you have any bad reactions or any difficulties with your past urinary catheter? No? Okay, great. And do you have any history of the urethral strictures? No? You have no idea what that means? Okay. No worries. Okay, great. So no difficulties. Perfect. All right. So Anna, we're going to go ahead and get situated. I'm going to get rid of my EHR. I don't need that anymore. All right. So before I get started, I'm going to go ahead and make sure my patient has full privacy. So we're going to close the curtain. In this case, we're going to close my door. And then make sure she's safe. And is there anything that you need at the moment before we get started? No? If you do need anything, just let me know, and I'll get that before we get started. All right, make sure the bed is at the highest position. For me, the highest position would be in my belly button area, but we're just going to pretend. So I'd lift the bed up, and then I would go ahead and bring down the rail right next to me. I am a right-hand person, so I'm going to be working on her right-hand side. All right, so once again, I'm going to gather my supplies. I have hand hygiene, which is my hand sanitizer. I have my catheter kit. I also have an extra pair of sterile gloves in case I need it. Tape, what I'd be using for my perineal care. Gloves as well. My hospital approved soap that I can clean her with, and a cloth. Okay. So let me go ahead and wash my hands. Hand sanitize. Okay. All right. So we are going to go ahead and get some clean gloves for us. All right. All right. All right, Miss Anna. So what we're gonna do is I'm just gonna bring up this drape just a little bit, and what I'm gonna have you do is put your knees up in a bent position. This is what we call a dorsal recumbent position. So we're just gonna move this up. Great, flex your knees up, great, perfect. And now if you can just relax, I'm gonna go ahead and rotate your legs outward just a little bit. Let me know if you have any pain. All right, and I see that there's good lighting. All right, so at this point, what I'm gonna do, Anna, is I'm going to go ahead and move the drape up just a little bit more. We're gonna go ahead and expose you. Is that okay? Are you okay? Okay, great. All right, so now that you're exposed, Anna, what we're gonna do is we're actually gonna go ahead and clean your perineal area. All right, so as I'm looking for it, I wanna just make sure I have my cleanser approved by the hospital. Perfect. So what I do is I put a little bit of warm water in here, I'd add a little bit of the cleanser, and then we're gonna go ahead and clean. So make sure you can see, perfect. I would start at the most distal part of the labia, and these would be there would be 3 different cloths. So we're just gonna pretend and use just 3 different sides. So we're gonna clean the most distal part of the labia, top to bottom. So they're more proximal to me. Same thing, top to bottom. And then we're gonna go ahead and clean the urinary meatus. And I am acknowledging that I can see where the urinary meatus is. We're gonna clean top to bottom. Okay? All right, now that she's clean, we're gonna go ahead and remove all of our supplies that we have used as of right now. Okay, we're gonna take these off. I do have a little trash can on the bottom. We're gonna dispose of all of this. All right, Anna, are you still doing okay? You are, okay, great, awesome. Okay, here we go. So we're gonna go ahead and now get my catheter kit. All right, so what I'll be doing is I'll be opening the catheter kit. I'm gonna actually use the catheter as more of like a trash bag, and I guess I'll just place it over here. I already have a trash can, but when I'm gonna go ahead and clean, I'm just gonna use this for an extra trash kit. Okay, say I have area, space. Okay, perfect. So before we begin, hand sanitize everything again before I touch any of my sterile. All right, so hand sanitize. All right, so we're gonna open our sterile field. So it's a sterile field, so I'm gonna make sure I'm in sterile area at all times. We're gonna open the first flap outward, outward, outward. All right, and here we are. And like I mentioned, we're gonna make sure it's sterile field. So any part in the white, I do recognize that there is a 1-inch border that is not sterile as of right now. Okay, so I'm actually gonna move this so it's easier to work for me. Okay. All right, so what I'm gonna do is I'm gonna grab this drape, and it's gonna be on the shiny side without breaking sterility. Let it fall naturally, and we're gonna place it right over here with the patient, not touching any of the inside. All right, since we don't have any sterile gloves right now, we're just gonna leave it like that until we go ahead and put them on. All right. So next is I am gonna go ahead and put on my gloves. So we're gonna get our sterile gloves. I don't have my back turned on any of my sterile field. All right, so we're gonna open the gloves on. All right, so first, check your thumb out. Okay, don't have my back turned. Now that's sterile and sterile, I can go ahead and adjust. Okay, and I'm going to touch the center because it's still sterile, and we're going to diva drop. So now we're going to go ahead and use sterile and sterile. We're going to fix this without compromising the sterility. All right. So next we're going to get our waterproof drape. Again, it's sterile on sterile. Okay, want to make sure we don't go over our sterile field. All right, so now I'm going to go organize my kit. This and the inside is still technically sterile, so we're just going to adjust everything. All right, so I have my kit right here. All right, so I just want to make sure that my urinary drainage bag is clamped, which it is. Okay. Move this over just a little bit. All right. So first things first, what we're going to do is we're actually going to clean. So I'm going to add my solution, my hydrogen peroxide. I'm going to put them all over my cotton balls. Okay, I'm not going to open it right now, but for the purpose, I would be using this all over my cotton balls that I would use to clean my patient. So diva drop. I also have lubricant. I would also open it. I'd open it, and then I'd also pour it all over. Okay, diva drop. All right. All right, so I have the lubricant out. So now what I'm going to go ahead and do is take the cover off my urinary catheter. So we want to make sure it remains sterile. Okay, diva drop. We're actually going to go ahead and place this in the lubricant. And of course, the lubricant will hold it there. All right, before we get started with the cleaning of the care, I'd also go ahead and attach my sterile water to the balloon inflation port. So I'll take the lid off, diva drop. Okay. We're going to go ahead and attach it. All right, with my non-dominant hand, I'm going to go ahead and separate the labia because we're going to go ahead and clean. So we don't want to cross over our field. So from the outermost or the distalmost labia, that's what I'll go ahead and clean first. So top to bottom, dispose. I'm going to do the most proximal, closest to me. So top to bottom, dispose, and we're going to do it in the urinary meatus, which I do identify. I can see it from here, top to bottom. All right, so we no longer need this either. We'll go ahead and dispose of it. All right, so now that we cleaned the urinary meatus from the top to bottom, and we've identified it. What we're gonna do next is I'm gonna go ahead and grab the catheter. I'm gonna grab about 3 to 4 inches from the tip, and we are gonna go ahead and insert the urinary catheter into our patient. Okay. All right, so I'm gonna go ahead and slowly push it in about 3 to 4 inches. Hey, Anna, is it okay if you can bear down, please? Okay. All right, so now that's to about 3 to 3 inches. I do see that there's urine flowing out of the catheter. And then since it's already up here, what I'm gonna do is I'm gonna go ahead and insert another 1 or 2 inches. Okay? So I'm gonna go ahead and release, and I'm gonna hold the catheter with my non-dominant hand. And what I'm gonna go ahead and do now is I'm gonna slowly inject the entire still water, which is about 10 milliliters. We're gonna do it slowly. All right. Okay. So we're just gonna make sure. Okay, so the excess of the catheter slipped out just a little bit, and I feel the balloon. Now I'm gonna go ahead and detach my sterile water. And we're gonna go ahead and get rid of that as well. All right, so after this, what we're gonna do is I'm gonna go ahead and grab the rest of this. Okay, so what I would do is I put this at the bottom of a bed. I go ahead and rail it, secure it, and make sure everything is good. In a perfect world, I would take this, take it off of her, but I do need to reuse it. So what we'll do next is I'm actually gonna go ahead and tape this to her leg, but leave some slack because we don't want it to tug. All right, so we're just gonna secure it with some tape. And how are you feeling? Great, great. Like I mentioned, we'd attach the drainage to the bedside on a non-movable rail. Right now, we're gonna pretend that I have one that's non-moving. I would go ahead and gather all of my supplies. I would provide any extra hygiene she would like or she requires. And what I would do is I would go ahead and gather all my supplies. I'm just gonna leave it here for just because I will be using it again. But I would just get everything out of here. I would go ahead and make sure she's clean, put her back into a comfortable position, make sure she's warm, she has the privacy that she needs. I would go ahead and also before I leave the room, I'd ask her if she needs anything else, make sure the bed is at the lowest position. I put the rail back up. There is, I open the curtain back before she leaves. There's a call light bell. So we're just gonna make sure all of that is good. And then all of a sudden, and before we leave, we'll be taking off all of our gloves, hand hygiene, of course, like always. So clean, 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 clean. All right, so at the end of everything, what I will do is I will document. So what I will document is the size of my catheter, if there's any odor to the urine, if there's color, the clarity of my urine, and then how much water was placed in the balloon, which we already know is a 10 milliliters of sterile water. All right, so Anna technically is in her most comfortable position, everything else. Anna, do you have any other questions for me? Any concerns? Okay, great. All right, Anna, so I will see you next time. If you have any issues, please just let me know. Feel free to call me. And thank you very much for allowing me to do this for you. All right.